We are Trilogy Population Health. Today, we will be covering the care planning process in care management. So, what exactly is care planning? Care planning in care management is the collaborative, patient centered process of developing a roadmap for an individual's health care, particularly those with complex or chronic conditions. It is a dynamic, ongoing process that is central to effective care management. A care plan documents a patient's health needs, preferences, goals, and the services required to achieve positive health outcomes. Next, let's discuss the care planning process. There are 5 parts to this process: assessment, collaborative goal setting, plan development, implementation, and monitoring and evaluation. Let's start with assessment. This process begins with a comprehensive, holistic assessment of the patient's medical, functional, psychosocial, and environmental needs. This includes considering social determinants of health, SDOH, such as economic stability and community context, which can affect health outcomes. Next, with collaborative goal setting, the care manager works with the patient and family to set realistic, measurable, and patient-centered goals. Using the SMART goal framework can improve adherence and outcomes. The SMART framework stands for specific, measurable, achievable, relevant, time-bound. Plan development is a detailed plan of action created to help the patient achieve their goals. This plan outlines specific interventions, services, and strategies, such as medication management, preventative care, lifestyle changes like diet and exercise, referrals to other specialists and community services, and providing educational resources. Plan development is a detailed plan of action created to help the patient achieve their goals. This plan outlines specific interventions, services, and strategies, such as medication management, preventative care, lifestyle changes like diet and exercise, referrals to other specialists and community services, and providing educational resources. Implementation focuses on the care manager's guidance in helping the patient implement the plan, which includes arranging services and coordinating with various providers. Lastly, with monitoring and evaluation, the care manager continuously monitors the patient's progress toward their goals, evaluating the plan's effectiveness. Updates are made regularly, especially if there is a change in the patient's condition. What are some of the key components of care plans? Effective care plans contain critical information that is accessible to all members of a patient's care team and their caregivers. This includes a variety of factors, such as patient demographics, which is a patient's personal information, emergency contacts, and insurance details; medical history, which contains a list of all current and past medical conditions, including chronic illnesses and mental health conditions; medication list, including all medications, dosages, and potential side effects; a care team roster, with contact information for all healthcare providers and specialists involved in the patient's care; the patient's goals, with a clear statement of the patient's desired outcomes and preferences; interventions and services, which are the specific actions the care team and patient will take to meet the goals; and community and social supports, such as referrals to non-medical services, such as food banks or transportation assistance, that address social determinants of health. What are some of the benefits of effective care planning? Implementing a structured care plan in care management offers numerous advantages for both patients and healthcare providers, such as improved patient outcomes, as our plans help prevent avoidable hospitalizations and emergency room visits while improving overall medical management, especially for those with chronic conditions; enhanced coordination by centralizing patient information and communicating with all providers, Care planning reduces fragmented or duplicated services and improves continuity of care. Increased patient engagement through the collaborative nature of care planning empowers patients to participate actively in their own health, leading to better adherence to treatment plans and improved self-management skills. Greater efficiency and reduced costs by targeting high-risk patients and proactively managing care. Health systems can lower costs through fewer preventable hospital visits and the more efficient use of resources. Reduced caregiver burden by helping informal caregivers by organizing complex caregiving tasks and providing a clear, consistent reference for the patient's needs.